Okay, so hello and welcome to our next topic of discussion, that is volume of distributions. We are into the pharmacokinetics segment. We have already discussed about one important aspect related to absorption, and now we are heading to the distribution portion. Now, as far as distribution is concerned, once the drug goes into the bloodstream, then eventually it gets distributed to the other tissues, and it's as simple as that. Okay, so while we have administered a drug, for an example, we have administered drug in a tablet form. This tablet form gets into the gastrointestinal tract, and from that gastrointestinal tract, it goes into portal circulations. In portal circulation, for an example, it goes under first pass metabolism. After first pass metabolism, it reaches to the systemic circulation. Now, till now, it was absorption portion, that was bioavailability, the fraction that was reaching to the systemic circulation, we already studied. Now this portion gets distributed to the various sites. So this is a distribution portion we are going to discuss. So now, which are the different factors that affects this distribution process? These factors are almost similar to absorption only, because here also drug gets distributed to various compartments, cells in the tissues of the body. So the movement of the drugs or the molecule would be as similar as we have seen in absorption portion. So obviously this drug movement depends in on lipid solubility. More the lipid soluble, we have already seen in absorption, more the movement of a drug it gets distributed. Its ionization status at its pH around the medium. More the drug unionized, more it gets diffused into the tissues and goes through the cells. Extent of binding the plasma protein, that is important aspects, and we'll study those things in detail, that what is this plasma protein binding and how this plasma protein binding affects the distribution. Presence of tissue specific transporters. There's these drugs gets into the various tissues, but for that, going into the tissues, for some drugs there are transporters. Okay, so through that transporters it reaches to the tissue. So these tissue specific transporters play a vital role in drug distribution. Regional blood flow. The blood flow of a tissue is important factor as it was in absorption. Fat and lean body mass ratio, how much fat you are having. Some drugs have a higher propensity to go into the fatty tissues, so they like fatty tissues, so these drugs need a higher fat mass. So how much fat is there or how much lean the muscle mass is there, so depending upon the structure of a body, that is variable during age, sex, and different conditions like obesities, the distribution also will vary. As the distribution is affected by plasma protein, so any condition that affects body's protein will eventually affect the distribution. So these conditions like chronic heart failure, uremia, cirrhosis, multiple conditions affecting heart, kidney, and liver, that will eventually affect the proteins, and that will eventually lead to alterations of distribution of particular drug. Now, important point in distribution we saw was plasma protein bindings. So let's say in brief, or let's discuss in brief about what this plasma protein binding means. Now, in the blood, or there is plasma, we already know in blood there is plasma, and in plasma there are some proteins. So simple, these are proteins present in plasma. So that is why it is called as plasma protein. But what's its importance? Its importance is certain drugs binds to these plasma proteins. No, certain drugs. So different drugs having different characteristics. Some drugs having higher plasma protein binding in characteristics. Some drugs binds to lower extent. So depending upon the drug's characteristic, they bind to the plasma proteins. Now, because of binding to this plasma protein, more the drug remains into the plasma, in bound form with plasma protein, lesser it will go to the peripheral tissues. Simple. We are having drugs which are more bound to plasma proteins. So these drugs remains more confined into the blood. So lesser drug reaches to the periphery. So here in this scenario, we can say the plasma protein binding is more. So drug remains more in a bound form with plasma. So eventually drug remains more into the blood and less it reaches to the periphery or none reaches to the periphery. In contrast, we are having different scenarios. We are having drugs which are having less plasma protein binding. So here the plasma protein binding is less and drugs do not bind to the plasma protein, so drugs are not confined to the plasma. They reaches more to the periphery. So they reaches more to the peripheral tissues, for an example muscles, for an example bones, for an example teeth, fat. So it goes into the peripheral tissues depending upon the its distribution characteristics and binds to these peripheral tissues. So here you can say the drug not confined to the plasma and goes into the peripheral tissue. So in these two scenario, what we can say is in this scenario 1 or drug 1 is having higher plasma protein binding and less distribution. Clear? So distribution is less because it gets less distributed to the periphery and more plasma protein binding. And in this scenario 2, we can say that drugs remain to the plasma. So it's having a less plasma protein binding. So drugs do not remain into the plasma and it goes into the peripheral tissue. So high volume of distributions. So high distribution, low distribution, high plasma protein binding, less plasma protein binding. So that is an eventual conclusion of this figure, right? So this was in brief about plasma protein binding. What is eventual plasma protein binding? What is its clinical significance? This is very important topic and that can be asked in examinations and we'll discuss in later half. First, let's see in brief what is volume of distribution. So here we have briefly seen an important top that is associated with plasma protein binding. More the drug is plasma protein bound, less the distributions, and less the plasma protein bound, high the distribution. So what is actually a distribution? What is volume of distribution? Then we will discuss about apparent terminology. Okay. Volume of distribution is, for an example, if we have introduced 1 gram of drug. Okay, so we are injecting 1 gram of drug into the body. And then after we see the plasma concentrations. So if we see the plasma concentration is 50 mg per liter. So per liter of plasma, we get 50 mg of drug after administering of 1 gram of drug. So we have injected 1 gram of drug into the body and after some time we have withdrawn the blood and we have seen that plasma concentration is 50 mg per liter. So what is the apparent volume of distribution? So volume of distribution says the dose you have injected, that is 1 gram, and if we convert that gram into milligram, that is 1000 mg followed by 50 mg per liter. So that liter would be the answer or the unit of volume of distribution and that would be 20 liters. So volume of distribution would be 20 liters. So what it says, you need 20 liter. You need 20 liter of volume to accommodate this 1 gram of drug in the body. So that is simple inference of these calculations. So it's a volume that will require to accommodate all the drug that you have introduced in the body. But the condition is the concentration should remain throughout the same into the plasma. So in short, it's a volume that you need to accommodate the infused drug in the body. So that is volume of distribution and sometimes it's not real. So that is why it is called as apparent. So what its clinical significance? Now, volume of distribution having its clinical significance before administration. So this figure is showing like you have not administered any drug. So you can say this is our body and you have not administered any drug here. What happens if you administer drug which are having low volume of distribution, as we have seen in this figure? Low volume of distribution means drug will remain more into the plasma and not into the tissue. So here you can say the drug is more confined to the systemic circulation, that is blood. So the concentration in the blood would be higher. So here you can say, see this blue picture is showing that the drug is been confined to the plasma because of higher plasma protein binding. It remains there. So the volume of distribution is low. These are examples of diclofenac and warfarin like drugs. What if the drug having high volume of distributions? And we have seen the drug having high volume of distributions goes into the peripheral tissues, fat, muscles, organs, even bone, teeth, and not confined to the plasma. So very little into the plasma. So now you can see here that drug is been distributed everywhere into the body. Okay, so if you get a concentration of drug into the blood, that would be very little, so lower concentration, but the distribution would be high. So drug is distributed into the tissues. Examples are digoxin, propranolol, morphine. So these are the drugs having high volume of distributions. Now what is its clinical significance? Why we are seeing this volume of distributions? So in case of poisoning with high volume of distribution drugs, they are not easily removed by hemodialysis. What is hemodialysis? Hemodialysis is like a filtration of blood. So if someone has taken higher dose of diclofenac or warfarin, can we remove the diclofenac and warfarin by the hemodialysis? The answer is yes, because we need to purify the blood. And if we purify the blood, drug is more into the blood, so this drug will be removed. But will hemodialysis work here? No, hemodialysis won't work here because drug is not confined to the plasma. Drug is not confined to the blood. Drug is everywhere in the body, and you cannot remove drug once it goes or when it gets distributed into different organs. And that is the main clinical significance of high volume of distribution drugs. So which tissues having affinity of with the drugs? So certain drugs having higher affinity with certain tissues. For an example, you can remember few like digoxin having higher affinity to the skeletal muscle and heart tissues. For an example, retina, chloroquine. Okay, chloroquine having high affinity to retinal tissues, and that is why chloroquine gets more deposited into the retina. And if there is a toxicity of chloroquine, or if you give higher dose of chloroquine, there is chances of retinal damage. Some drugs have a high affinity to the bone and teeth. For an example, tetracyclines, heavy metals. So if you give these drugs, it will get deposited into bone and teeth, and that may affect them. For an example, drugs like thiopenton having high affinity to the adipose tissue, so it goes into the fat muscles very fast. So different drugs having different affinity. For an example, iodine have a high affinity to thyroid tissues. So there are various drugs, you can remember few of the examples. And these drugs, some drugs having a characteristically high affinity to some tissues, and that is why it's been shown chloroquine induced maculopathy. Chloroquine having a high affinity to the retinal tissues. Tetracycline have a high affinity to teeth, so teeth deformities due to tetracycline. These are some of the examples associated with it. We'll talk about distribution in other part as well, but this was the brief about distribution. Thank you very much. If you are having any doubts, you can